Welcome to the Benefits Executive Roundtable, hosted by Dorothy Cociu, President of Advanced Benefit Consulting. Dorothy is a nationally recognized benefits and compliance consultant and group health broker. Here, you will watch and listen to industry experts who will break down the latest trends in employee benefits, healthcare reform, state and federal legislative and regulatory activities, all designed to empower executive decisions. We are proud to bring to you all new video podcasts. We hope that you enjoy your new video podcast format, and please forgive any audio or video imperfections. Thank you for viewing and listening. Meet Advanced Benefit Consulting, an award-winning boutique benefits broker and compliance consulting firm that offers comprehensive benefits and compliance consulting. We offer personalized service and the ability to work directly with the owners, Dorothy Cociu and Anthony McCarron. Between 2022 and 2024, Advanced Benefit Consulting has been recognized in multiple publications and professional magazines for their amazing accomplishments throughout the industry. We specialize in health plan compliance, so you don't have to worry. We provide compliance assistance on HIPAA privacy and security training, ERISA, the CAA, including RxDC, and Gag Clause prohibition. We offer monthly webinars and seminars or various lunch and learn programs for your continued education. In addition, we are proud to have Marilyn Monahan of Monahan Law Office on retainer to assist with any legal matters for our clients. We also offer an on-demand educational platform and our very popular podcast series, The Benefits Executive Roundtable, to help your company learn and grow at your own pace. At Advanced Benefit Consulting, we are here for you throughout the entire year. We invite you to contact us or connect with us on LinkedIn.
Welcome to the Benefits Executive Roundtable. I'm your host, Dorothy Cociu, President of Advanced Benefit Consulting, and I'd like to welcome my guest today, Steve McClung, CEO of Hines Associates, which is a nationwide independent leader in personalized managed healthcare and healthcare cost containment. I want to welcome Steve and thank you very much for being my guest today. I really appreciate it.
Absolutely. No, Dorothy, thank you for the opportunity to come and discuss with you and your listeners. I mean, I think we all kind of share a passion for the healthcare system, some of the things that maybe are a little broken that we all look to try to find ways to fix. And hopefully today we'll get into some discussions around options on how to fix some of those things.
Yeah, that's what I'm hoping for. Absolutely. And by the way, it's not just audio anymore. We are on Spotify on video as well. So we do have video viewers as well as listeners, but we still have that loyal group of people that still, listen to their podcasts on a regular basis. So that's great. I just want to point out, as a matter of full disclosure, which I always do whenever we work with a company that my company ABC works with on a regular basis, Advanced Benefit Consulting has been working with Hines Associates for well over 3 decades now. They are our preferred utilization review, pre-certification, and case management provider for some of our self-funded health plan clients. Others from Hines have been my guests in the past, but I wanted to bring Steve in because there's something new and exciting, I think, that Hines is doing this year. Well, for more than a year, but it's new to me in the last year or so. And I wanted to talk about it because it's something that we've been asking you at Hines, we've been asking anybody in the industry to do for quite some time now, for a few years, because we do have a lot of clients that are self-funded and we have some that use reference-based pricing. And for anyone that's worked with reference-based pricing, I think you know that that can be challenging with provider situations, providers pushing back on claims and so forth. So we got really excited when we had this email pop up from Hines Associates not too long ago saying that you're offering a product called Opus One. And that's what I want to talk to you about today, because I know that you have a whole menu of services, and we will talk about that as we go through this podcast today. But the one I want to start with, which is, I think, something that our self-funded audience would really like to hear about, is what you're doing that changes the reference-based pricing market quite a bit, in my opinion, and I think others too. So let's start with that. Let's talk about how self-funded employers, plan sponsors can actually maybe perhaps manage the risks a little bit better when using reference-based pricing. Historically, and this has been the problem that particularly my business partner, Anthony, has always been talking about for years and years and years since we started working with reference-based pricing, the problem with RBP is that the RBP vendors negotiate after the claim is completed. The plan participant goes to a facility, has their pre-certification, they go in for their surgery or they go in for their inpatient stay. Once the claim is complete, the TPA receives the bill, which is sent either directly to their RBP vendor or to the TPA, who forwards it to the RBP vendor, and they reprice the claim based on the percentage above Medicare rates, which in a lot of reference-based pricing plans might be 130%, might be 140%, maybe 175%, whatever the percentage is above Medicare. And basically, the claim is adjudicated based on that rate above Medicare. So what happens then is that on certain occasions, more often than we'd like, the provider receives the claim payment and they say, no. Even though they had it pre-certified, even though perhaps they were told in advance that the plan was going to pay X percentage of Medicare, they still, as providers sometimes will, they try to challenge that, right? And they say, okay, we're not going to accept this 140%, let's say, of Medicare. And they billed originally, let's say, at 1,500 or 2,000% of Medicare, right?
Yeah, or more sometimes.
Yeah, or more. Yeah, exactly. And sometimes what they want to do is say, well, we'll take a certain percentage off of the billed rate. Well, the billed rate means nothing to anyone because the billed rate is whatever the provider wants it to be, right?
Exactly.
I mean, we've had situations where outpatient foot surgery should have been, a couple of grand and they charged $450,000 for it and said, well, we could have charged you $1 million, right? So that's kind of the game that happens, and the game that's played on a routine basis, unfortunately, with providers. So they get this claim and they say, no, that 140% of Medicare is not good enough. So then they start challenging it, right? They threaten to go after the patient for the balance bill them. They more often than we like, they threaten lawsuits, get attorneys involved, and sometimes they do actually file lawsuits. So our concern with this has always been, why is everything done after the fact? Why can't it be done up front? Why can't they see that this potentially could happen up front? And so, as you probably will recall, we asked Hines Associates a while back if they could do something in advance. And at that time, you were just testing this with your own people, right? It wasn't actually on the market yet, because one of the things Anthony and one or two of our clients had said historically was, why can't they do it at the time they have the pre-certification? They know the claim's coming. They know what's going to be done. Why can't we negotiate then instead of after the fact? Because let's face it, after the fact, the plan has no power, right?
All your leverage is gone.
Yeah, exactly. Your leverage is gone. And basically, the plan sponsor is at the mercy of the provider if they accept that claim or not, right?
Yeah, exactly. And the golden hour principle in emergency medicine says if you intervene early on, you're going to have a better outcome at the end of the day.
Right.
And that's kind of what we've applied here, is just said, hey, look, if I can get involved at the time a pre-cert is occurring, really, either I could steer you to somewhere else and now I have some leverage, or I can get the provider before a bill has dropped at 2,000 or 10,000 times Medicare. That's their starting point for this negotiation. Well, that doesn't exist. There is no charge. Now I can start from, hey, Medicare's a reasonable starting point. This represents something above your cost. You're still making a profit. Let's talk about a Medicare-based deal. And if you're unwilling to accept, then we'll find another provider in your area who is willing to accept that. Right. And you're going to have a better outcome every single time. Just as with the golden hour in emergency medicine, if you intervene quickly, you're going to have a better outcome. Same thing on this level. It's just the exact same principle applied to a negotiation, really.
Right. So basically, just to walk our viewers and listeners through this, explain what happens from pre-certification. What happens?
Perfect. So pre-certification comes in. Hines immediately, the first question that we have to address, it's a URAC accredited, is it medically necessary? So we can't deny something based on whether something's not medically necessary or not. That said, in parallel to that, our concierge team can jump on that and say, okay, great. Nurses are going to look at, is it medically necessary? We're going to look at, hey, can we get a deal in place? And we're going to call up the facility and make sure, are you going to accept the Medicare amount that the plan covers? And if not, is there something that we can do within reason to make it such that this patient can get seen there? So while on the one hand, we've got nurses looking at medical necessity, on the other hand, we've got a team that's trying to negotiate a deal at the facility in question and looking at, and our general rule is three options. So the facility that it starts at, patient went to whatever hospital, clinic, and two others. and see, okay, do we have an agreement in place in this area? And what is that agreement? Is it going to fit within what the plan requires? And if not, then let's reach out to these other facilities. And we look at the quality information as well for each of the facilities that are involved. And then we can go back to that patient and say, hey, look, patient, here's, where you were going is not willing to deal. They're not going to accept what the plan covers, which means that you're going to have out of pocket. I mean, there's going to a potentially infinite amount of pocket because nobody knows what that provider is going to bill. But here's two other options that are equal quality that may be a little bit farther away. Maybe you got to go 2, 3, 5 miles down the road, but they're going to accept it. You're going to have no out of pocket, and the provider has this level of quality that's equal or better than what you were getting elsewhere. And so that dialogue happens between our concierge team and the member. And in parallel, our nurse then has said, yes, this is medically necessary. And it's up to the member to make their informed choice at that point.
Okay, well, that's exactly, as I said before, that's exactly what we've been asking for somebody in the industry to do for a number of years. And I'm just very, very glad that Hines Associates actually started doing this, because, again, this is something that I think will hopefully change the RBP world for the better, right? Because it was a great thing when it started, and then the providers started getting smarter about how RBP worked, and they started getting people involved and filing more lawsuits, and they decided that it was cheaper to file a lawsuit, then so they hired these attorneys, and they just said, get what you can, and we'll pay you your percentage. And it just got really, really ugly. So what started off as a great thing in RBP started to be very negative in the industry under a lot of circumstances, which is very unfortunate, because reference-based pricing is a great way for plans to save money, right? So when you
absolutely,
when you take that away and it just starts to get very ugly, and you're involved in 3 or 4 lawsuits a year, all of a sudden the savings that you thought you were getting, that's gone, because it's going towards lawsuits, right? And nobody wants that.
Exactly.
Right. So let me ask you a question, which is, I think, a really important question. How often are these pre-service agreements executed? And, what is the percentage of their success? How successful have you been with this so far?
Yeah, so great question. And it's really going to vary quite a bit by group in terms of how often. If you've got more pre-certs that are required, that gives us more opportunity to intervene. Some groups, the patients are just going to go, they're going to get their care, and we're not going to have to intervene, but on a handful of them. When we do intervene, when we get that opportunity to do these case agreements up front, we're seeing, 90+% of the time that we are achieving a satisfactory result for, the plan and the member at the end of the day. Because remember, the member is the one that ultimately gets the right to make that decision. So we're saying, hey, here's the options. Most of the members are going to make the informed, hey, I want to go here because it's going to be lower out of pocket. Sometimes the member says, regardless of that, this is my facility of preference and I'm going to go there. And then but at least they've made that decision and they're accepting the risk on the out of pocket side.
And you gave them options.
Exactly.
Which they didn't have before. They thought they could only go to this one provider that said that they were going to do this one surgeon. But they don't realize perhaps that surgeons, if they want to use, if what they're really invested in is the surgeon, that they may not know that surgeon has privileges at 5 other hospitals or outpatient surgery centers, right?
Well, and that's our first step is, can we keep you with your doctor or your surgeon in this case?
Right.
Not always an option. Sometimes that surgeon doesn't have admitting rights. Just interesting dynamic for you and your audience to understand. Sometimes that doctor may actually be able to help us get a deal at the facility, because they're going to say, look, I can either do the surgery here, or I can go do it at the other one that I've got admitting rights to. What do you prefer?
Right.
And the facility might then turn around and go, ooh, yeah, the doctor's right. Let's do it here.
Right.
And suddenly we have a signed deal in place, which saves everybody some time and energy. So it just depends on the circumstances. It's not always a kind of cookie cutter solution, which is the beauty of what, having a concierge who's informed and understands what's going on and getting involved and being able to find the right answer for that very specific scenario.
Right. And we'll come back to that concierge concept in a moment, because I think that's pretty important, but I want to kind of stay with this negotiation part first and kind of wrap that up. So let's talk about your negotiation team. Do you have in-house negotiators, and do you have an in-house attorney to work with these situations? Because sometimes you need an attorney. So why don't you inform our audience about that?
Absolutely. Great question. So we have a team, probably about 30 to 35 negotiators, I believe, right now. They've been with the organization 10 plus years. They've just got a ton of experience. We actually break it up into a couple of different scenarios. So we have what we call FLN, which is first line negotiations. If you're going in for a physician and we've got to negotiate some, I'll call it rather minor procedure, or just you've got a doctor who's maybe an ongoing annual health checkup, and we want to make sure that there's a deal in place, we can do that with the FLN. That's what they do. They focus on those. We have the outpatient, usually an outpatient surgery type of team. They'll get in and they'll involve. There's different Medicare rates. There's different things at play, so they have a different understanding, and they'll tackle that. And then we have the inpatient team that for your big hospital, major hospitalizations, they know all the hospitals. They've dealt with them for years. They've got the right contacts. They know who to talk to and what levers to pull. And then in the sort of, you talked about, well, sometimes the claim just comes in after the fact. We have a forensic team that'll actually pull everything apart and look at all aspects of a claim. We call them the CCU, Complex Claims Unit, and they're kind of the ones who've had the most experience. There's some medical expertise, and the lawyer plays a part of that. So we have a couple of different lawyers in-house on the attorney side. Not every negotiation goes the way that we'd like it to, and sometimes you got to get the attorneys involved, unfortunately. But we do have an in-house legal team. The attorney that is involved in that CCU is the one that's kind of your frontline person, but they also have access to a couple of other lawyers internally, as well as an extensive network of local legal representatives throughout the country. And we've been doing this for years, and when we need to, and it gets a little ugly, we get the lawyers involved, and we have some solutions when that's required.
Right. Right. Well, thank you for that. Well, let's go back to, and those are all great things. Let's talk about some of the negative things. What happens if the provider doesn't accept the plan terms? They just won't do it. And you mentioned that you have the additional provider options for the participants. Tell us a little bit more about that. What happens specifically when the provider says, no, we're not doing that?
So again, it comes back to that, hey, we're looking at these three options. So provider one said, no, that's fine. Again, now as the members got the choice, they could still choose to go there, but we're going to go out and reach out. And we've either got a contract, because many times we'll already have an ongoing relationship with the provider in the area. And if we do, we're going to present that. And if we don't, we're going to reach out. We're going to have conversations with other providers in the area to establish a single case agreement. We roll all of this into a one-pager that we provide to the member that says, here's your three options, and we order them. Strategically, we say, let's put the one at the top that we prefer that they're going to choose. But we provide all three, and we say, hey, look, here's the information you need to know. Here's what you're going to have to pay out of pocket if you go here. Here's what the plan's going to reimburse, so that they understand what their employer is going to have to pay for something as well. And here's the quality rating, so that you can see stacked up next to each one, here's exactly what's going on. We'll also provide a little bit of hey, here's where that provider is located, because sometimes that is a consideration. If I got to go halfway across town or what have you to get to the provider, I want to know that and be aware of that decision. And in some cases, we'll actually go ahead on the concierge side and make arrangements for, some transportation. If somebody's saying, hey, I got to go, 45 minutes out of town to get to this provider, well, we'll make arrangements and get you there. That's not a problem, because it's going to save the plan this much in the long run.
Right.
So that's kind of how that goes. And generally speaking, the members are going to choose the provider that makes more sense to their own pocket.
Right. Exactly. And that's what we hope for, of course. And thank you for bearing with me and can go kind of continuing down that path, because obviously we had a good discussion, but I knew there were additional things that I wanted you to cover, because obviously we've been working with you guys on this product. So I wanted to make sure that everyone was aware of all those extra steps that you take, because it's not as simple as what you might think. It's not, okay, they're going to accept the terms or they're not. There's a lot of steps involved, and it impacts the participants particularly. And those are some of the things that I wanted to talk about. So thank you very much for that. One thing that we didn't really mention, but I think we should clarify, most self-funded clients that are using RVP financing, they hire an RVP vendor, and their job is to reprice claims, correct? I mean, that's what they do. They reprice the claims based on that percentage above Medicare, which we talked about in the beginning. And then if there's a payment dispute, they have their negotiating team. But their work, as we mentioned before, is primarily repricing. That's what they do, right? And whether or not they have additional services, which most of them do, I'm not saying they don't, they do have a negotiating team, but that's after the fact. So let's make it clear. I want to make it clear to everyone that you guys also reprice RVP claims, correct? You not only are you are a company doing these things, but you also do the repricing.
Exactly. So 4 years ago, Hines added to or expanded by being added to the global Excel family of companies. And with that came this ability to reprice claims to Medicare rates, to negotiate all of those claims either upfront or access contracts or build custom networks. And so really the beauty of what we're offering here is it's all under one house. And RBP is a great solution. The vendors out there that are offering just that pricing component, it's a necessary component to what you need to do. But having it all under one house, having it all under one integrated, seamless solution really does make a big difference. There's not as many cracks in between things for things to fall into. You know what I mean?
No, I like that a lot. And it's also, and we're going to talk about this more, we'll talk about the concierge part of this, but you have the ability to see the case through from the beginning to the end, which is something that some of our RBP clients have been asking for, again, for a number of years. And that was a solution that you guys can do that because it's all under one roof. So I like that a lot. So let me ask you kind of a silly question. Do people even need a separate RBP vendor anymore? Is that even a requirement?
No, it's a great question. No, the short answer is no, you don't. It's an essential component, but if you can get somebody that provides all of it in one house, why wouldn't you eliminate the risk of things falling in between cracks?
Right, exactly. So I just wanted to clarify that again, because some of our listeners, they may not be involved directly with RBP, but maybe they've been thinking about it because someone's been recommending it at their TPA, and they just don't know who are all these vendors and so forth. Yes, I've been hearing about this RBP vendor and this RBP vendor, and I'm hearing about this RBP vendor. I just wanted to clarify and make it clear in their minds that this is a solution, not the only solution, but this is a solution now that allows you to put all of those services, including RBP, repricing, negotiation, and the utilization review services, which there are a lot of them, all under one roof. So I just wanted to clarify that and make sure that people understood that. I want to move on now to another topic that is really important, especially since the Consolidated Appropriations Act, they put out the No Surprises Act a few years back. So let's talk about that because it's an important part of the claims process these days. What do you guys do about NSA claims? Can you walk us through your No Surprises Act process and your early negotiations before they enter the IDR portal? Because there's a time period that you can negotiate before it goes into the portal. Some of our listeners are very familiar with this, some may not be. But it's a really important part of this whole puzzle that self-funded employers have to deal with. So can you kind of just walk us through the NSA process and what Hines does in that process?
Yeah, absolutely. So you actually highlighted it very well, just in the fact that there is a period before you get to the IDR where you're supposed to negotiate. That was the original intent is, hey, let's not end up in the IDR. Let's give them an opportunity to talk. And that's where Hines, our focus is, let's resolve it before it gets to, and quite frankly, the IDR process, it's a great process, but really you're rolling the dice. And there's some vendors out there that are claiming, hey, 80% of the time we're winning. The general data that I'm seeing says about 70% of the time the provider is actually winning at the IDR process. Yes. So avoiding that IDR process and rolling the dice on what's going to be the outcome is probably your best scenario, and that's where we focus our energy. So we're trying at all costs to negotiate during that 30-day period before it gets into rolling the dice, so to speak.
Right.
But when it does go to that process, I mentioned earlier our in-house attorney, he's heavily involved. Those are the ones that he's going to follow through, make sure that we're submitting all of our data. So we have a huge data store of historical claims that we've paid, as well as a lot of the commercial databases that are available to us, so that we can really say, hey, here's what the typical reimbursement is in that area for an in-network for the same procedure, and we can submit an offer that we feel is going to be accepted at the IDR process. When it comes out the other end of that, we're seeing slightly better than what I'm seeing at the 70% provider win rate, but the vast majority are not getting to that point. And that's the key for us, is how do we avoid getting to the point where we're leaving it up to the IDR process? That's the general data is showing provider wins most of the time.
Right, and they do. And I want to again, for the benefit of our audience, who basically you have to come up with a qualified payment amount, a QPA, right? You guys have databases and allow you to do that. So I just wanted to mention that, correct? And also, I wanted to mention, too, that when it goes into the portal, and the reason that most providers win, I think, personal opinion, is because, first of all, they do a better job of submitting, right? Because a lot of the TPAs who have been involved in doing this, they're not NSA experts. They don't know this, and they haven't really hired the teams that they should in advance to do that. And unfortunately, once they're in the portal, there aren't that many arbiters, and these go to arbiters, right? Yep. and basically there's only like a dozen of them in the whole country, and all they're trying to do is punch them, just get them out, just get through them. And so basically what you present into the portal is very, very important in how you present it and what kind of backup that you have to support the qualified payment amount, why you're saying that your rate is better than the provider rate. The providers do an incredibly good job. They've hired people to just do nothing but NSA claims, right? So theirs are easy, quick bullet points with all the detail behind them. They put the bullet points up front so that the arbiter can just glance at it and say, oh, okay, instead of reading pages and pages and finally coming to a conclusion 89 pages later. They don't have time for that, right? So the providers have done a really good job of doing a good bullet point summary up front and then providing the detail behind it and all the backup and why they're surgeons and why they're doctors and why everyone is so much better because they have all this experience and so forth. And again, unfortunately, the plan sponsor employers and their administrators haven't always done that. They've been slow to get that going. So, of course, if the arbiter has to pick one or the other and one makes it simple for them with all the backup, but summarizing it quickly and easily why they're the best, they can kind of one-page glance, okay, I'm going to choose this one, right? And it's baseball style arbitration. They pick one or the other. There is no splitting it down the middle. There is no negotiating. It's one or the other. Either the plan sponsor or the provider wins, period. And I just wanted to make sure that everybody was reminded of that. We've done several podcasts in the past on the No Surprises Act and the portal process, but I just wanted to kind of remind people because they might, I kind of forgot about that. Yeah, that's what we're talking about. So it's really important. So
you make a really good point on that in that, if you think of a hospital system or even just an individual hospital, they have a huge revenue cycle management team who are experts in exactly what you just described. Your typical TPA, they don't have the ability to invest as much in that.
Right.
We, our legal team and our negotiations team have been doing nothing but negotiations on these types of things. We have the data. We're able to present it in a way that is clear and defensible. And so, we are seeing a better than average outcome, but you're still talking about a hospital system that is investing massively in making sure they win.
Yeah. And they have. Unfortunately, that's the way it's been happening ever since the portal opened. They really need more arbiters, but they don't pay them anything. They get paid so little. Why would they want to spend any time on anything to really absorb both sides? I mean, it's whatever's easiest for them to understand and read quickly, right? And then
the floodgates, the amount of things going through that process, it was a tsunami. How did you expect them to deal with it? Quick, decide, don't take time to really reflect on it.
Well, the government, I think, thought that there'd be all these people wanting to do this job, but when they saw how little they were being paid and what kind of work that they had to do to get to a decision, not that many people stepped up and said, yeah, I want to do this, right? They have better things to do with their time than work on NSA claims in the federal portal. So anyway, thank you for your explanations on that. I greatly appreciate it. Let's take a step back now. Besides the RVP functions now that Hines can offer, you do offer, of course, a full spectrum of cost containment options. And we've already talked about some of them, pre-certifications, case management, but you also have provider care navigation, navigating people to friendly RVP providers or to network providers if they have a network involved as well. And now, of course, you do the repricing and the balance bill handling and everything else. So tell us more about the depths of these services that you offer outside of what we already talked about.
Absolutely. I appreciate the lead in there. You mentioned at the very outset that, we've been working together for over 3 decades. Hines has existed for almost 4 decades now. We started in utilization review and case management. The whole goal was make sure things are medically necessary, make sure that they're appropriate. And so that's kind of our core. And then helping people to navigate and make sure they stay out of the hospital. We've added to that our wellness services. So we actually have a team of wellness coaches that will keep you healthy and hopefully not needing to access any of those other services and producing claims down the road. And then we have a chronic condition management, which really is, you've got that ongoing situation. And it's amazing. If you look at the data, most people don't have one chronic condition. They have multiple chronic conditions, 2, 3, 4 more chronic conditions. Diabetes, obesity come together, hypertension's in there as well. And so our team, they're just amazing. They do a fantastic job educating people, making sure that they're staying on top of their condition and it's not exacerbating and you're not ending up in the ER, which is really the end goal. Nobody wants to end up in the ER. And if you're keeping on top of your medication or, getting your steps in every day, getting the healthy meals that you're supposed to be eating, you can avoid that hospitalization down the road. So we've brought a lot of technology to that to help the team to be able to educate people and monitor their activity and help keep an eye on things. So that's one of the other services that we offer. And then we've touched a little bit on, care navigation and negotiations. If you've got out-of-network claims where you need some help, we can negotiate those and get you a deal. We can build custom networks. There's a lot of things. We call it our CCR framework. So care, cost, and risk management is really what that's all about. From the outset, from wellness all the way through to what happens after the fact when you have a claim and somebody gets a balance bill. We can help you manage that dispute or help your member manage that dispute on your behalf. So really the full gamut of services.
Right. Well, I appreciate that information. Let's talk about specifically your Opus One product. That's a new product. And, I just want everybody to know about this because I found it very fascinating. And obviously, that's why we moved some clients. We moved our first client to you guys not too long ago. And it's a wonderful product. So why don't you just explain to our audience, what is Opus One exactly and what services are included in that product?
Perfect. So Opus One is essentially, it's the one product that incorporates everything we do. So from, our wellness app is included. We want to make sure we keep people healthy when we can. It also gives us a channel to communicate with people when we need to. And then it goes all the way through to the negotiations and everything else in between. It's really a health plan and we use the term RBP. We tried to kind of differentiate from RBP by calling it Opus One because we said it's not just your typical RBP, pay and chase after the fact and hopefully the provider accepts it. It's let's get involved at the upfront, make sure the care is appropriate, and at the same time, make sure that the cost is appropriate because we all know that, you can get the best care in the world and it can cost a fraction of what it might down the road where you're not getting the best care in the world and they're going to charge 5,000, 10,000 times Medicare and expect you to pay a 30% discount off that bill, which is just
what a discount.
Complete highway robbery.
Exactly. Well, tell us about Opus One and how they work with TPAs and health plans.
So exactly the way that you would expect in this scenario, the TPA is still the core, payer of claims. They're the ones that are going to process everything. What Opus One brings to that table is an ease of doing business. So instead of the TPA having to deal with things after the fact when things get a little bit ugly, we're dealing with it the upfront, making sure that things are nice and smooth and that we can do that handoff to the TPA to make sure that claim is paid, it's payable at what rate, and we can provide the Medicare amounts so that they know what to pay it at. So it's a partnership with the TPA. And in this case, it all depends on what TPA you're bringing to the table. I know you have a really strong partner that we've loved working with for many years in EBA&M, and they're fantastic. So every TPA has slightly different nuances, but we find the way to integrate with them, work with their processes, and adapt our methodologies to what they need. And the health plan is the same thing. We're going to customize to what the health plan wants to see at the end of the day. If they want 140 Medicare, if they want 130 Medicare, if they want 175 Medicare, if they want, co-pays, deductibles that are very high to help provide incentives, we're going to work with that. If they want, just to push everything to out of pocket, we can do that. So we customize to every individual health plan and every TPA that we work with.
Well, thank you for that. And I want to ask because you were talking about the TPAs, are there any additional files or uploads that are required for these programs?
Yeah, so for one of our typical clients, we're going to ask for a claims file so that we can do what we call claim scrubbing to look for cases that we can help manage. That's a one-way feed usually from the TPA to us. Not everyone provides it. If you're getting the Opus One, that's an essential. We have to have that. But in addition to that, we're going to send back that claims file with the repriced amount so that the TPA knows what the amount to pay for each individual claim is. So that's kind of an unusual or additional piece, I would say, to Hines is typical. Every TPA, if you're working with an RBP vendor, you're going to have to do that piece anyway. So it's not outside the norm of what you would be doing.
So it's just maybe more frequent, but otherwise pretty much the same files, right? That they might have been working.
Exactly.
Okay.
Exactly.
Okay. All right. So let's talk about your concierge services, because you mentioned those a few times, and I think it's a really important part of this whole program. And I just want to clarify that when you're dealing with a concierge at Hines, you're dealing with a live human being and not a robot, right? It's not a chatbot, correct?
Absolutely. This question, with today's environment of AI everything, this question could not have been more perfect. A little bit of background on me: I am a tech person by background. There was several years where I spent a lot of time in the tech world. I love technology; it's fantastic. That said, it never is going to replace the human interaction. At least it should never replace the human interaction. If I could give a quick little story about one of our nurses interacting, I think it illustrates my point in that one of our nurses, Carla, oncology nurse, she was dealing with an oncology patient who unfortunately ended up passing away. She had dealt with him for, probably 2 years through the course of treatment that he was receiving. He got better, he got, worse, and towards the end ended up passing away. She dealt with the spouse for quite a while at the end of his life. And when he passed, the spouse invited Carla to the funeral. And she went to the funeral, and she was introduced to everybody that was there as his friend, not as the insurance, not as his nurse, even as his friend. And that type of human interaction, you're not going to get that through AI. You're never going to have AI show up at someone's funeral and be introduced as a friend, right? So I want to find ways where we can bring technology to help the concierge be better at their job. Yeah. But I always want a human picking up the phone when someone's got, hey, I've got a question about my insurance, or I'm sitting in front of a provider who's saying that they don't know who I am. We're going to have a human take care of that situation and make sure that we build that relationship with the member and with the provider to make sure that at the end of the day, it's the right care at the right time.
And also, as you mentioned, the patient's families as well, because sometimes they're very much involved with this whole situation, right?
Well, if you think of, let's take an example of a young son or daughter going in for care. Well, it's the mother that you're going to be speaking with, or the father that you're going to be speaking with, and helping them navigate the scenario and make sure that they're aware of what's going on. So we want to make sure that we're reaching out to the right people and helping them figure out how to navigate it, because it's a stressful time. Someone's sick, someone's not feeling well, someone needs a surgery. The last thing you want to deal with is a bunch of bureaucracy, and especially if that's just going to be a bot that you have to talk to, right?
Oh, that's so frustrating to me when I can't get a hold of a live human being. Oh, I just want to talk to somebody and explain what's going on, and it just drives. And that's not with my health services. That's with everything, right? That's just it just drives me crazy. A ticket service, you're trying to buy tickets for a concert and having issues. Whatever. I want to talk to a human being. Don't let me go through this.
I can't tell you how many times lately I've called and I don't even know if it's a human being or not. But no matter what, I'm not getting an answer to my question, and I'm just like, can't I get a human being that I can talk to on the phone and we can dialogue through this together and find a solution? That's not where Hines is headed. We're not going to be the company that offers that bot service. Right. We may bring a bot in that could help our agents answer some questions. Our agent will talk to the bot and say, hey, go look through the plan document and find the wording on this for me, and the bot will go search that and say, here you go. Right. But you as the member are always going to be speaking to one of our concierge people. Human beings.
And that's a great positive. So what kinds of things in general can a concierge do for a plan participant? What can they help them with? Because you gave a couple stories, but give us some examples on what exactly they can do for them.
So oftentimes it's going to be, I'm looking for care. I need this surgery. I want to go, and I'd like to know who's in network, what options I've got. And so we talked about, hey, here's the different options that are available to you. Sometimes, and this is just the nature of an RBP plan, you're going to be sitting in front of a doctor who's saying, I've never heard of this plan. I don't know what this is. I'm not accepting it. And so our concierge, you reach out to the concierge is going to call the doctor and make sure that we take care of that. Mm-hmm. Oftentimes that might be something as simple as, hey, in the drop-down menu in your system, you need to go here and select this, and all of a sudden everything's fine. Other times it's let's put in place a contract to make sure that we're fully covered. And then you can go all the way to the end of the line where something happens, you get a balance bill. What's going on? I want to know what to do with this. Call our concierge service. Our concierge is going to walk you through exactly how to handle that. And if they need to get somebody else involved, they can reach out to a negotiator. They can reach out to one of the lawyers to ask some questions. They have tools at their disposal to help your member navigate that situation as well.
Right. Well, thank you for that. When they contact the concierge, how do they do that? Is there a dedicated phone number? I understand there's a dedicated phone number that they can call rather than going through a whole process of press 3 and press 2 and press 9 and press this and waiting 25 minutes to get through.
Exactly. We've got one number you call. So for the members, you've got one number to call. Providers have a different number that goes into the queue and the press this and the press that. But if you're a member and you need help from a concierge, here's your phone number. You call that. It's going to our concierge team, and they're going to answer your call. And they're going to answer your call timely, and they're going to respond to your actual needs, not go to a voicemail and hopefully you get a call back a week later.
Right. No, I know. I was joking when I said that what a concept, but that's the reality, unfortunately, of our industry sometimes, and it drives people crazy. It drives me crazy, and I've been doing it for way too many years, right? So let's talk about another thing that you brought up, which is your well-being prevention and chronic condition management programs. Can you tell us about that? Tell us about the app. Tell us about how these disease management programs within that. Tell us all about that.
That's a perfect follow-up, actually, to the last question where I just got through saying, hey, technology is going to support, and that's exactly what it does. So on our wellness side, we have an app, and the app actually helps us. We'll run challenges through the app. We can push specific educational materials through the app, and it's fantastic. But behind all of that, again, is our health coaches. So if you're buying into the wellness offering, you get a health coach who's going to help you either build a specific tailored program to whichever member it is that's engaged in the app and says, hey, I've got these conditions that I'm worried about, or these things that I'm thinking. We actually have an HRA, so a health risk assessment that you fill out. And then that will develop with our health coach a custom program for you as an individual. Hey, based on your answers to the HRA, here's a program to help you maintain healthy lifestyle, improve on whatever it is you may have identified you wanted to improve on. Hey, I'm trying to lose some weight. Great. Here's a weight loss program. And then if you go one step beyond that, you get into the chronic condition disease management programs. Then we have a different level of technology. And this one is actually more monitoring and actually pulling biometrics off of a band and saying, okay, right now maybe you're not getting as much sleep as you typically do. The data that it pulls is fascinating, and heart rates, all of these things. You can imagine if you've got an Apple Watch type of thing, you're probably familiar with some of the data that can be pulled off of a band these days. But that feeds back into a tool that our nurses have access to, and they can enrich the dialogue with your members when they're saying, "Hey, I saw you didn't sleep well for the last couple of days. What's going on? Let's talk about that. Why is that? Oh, yeah, I was having indigestion. Did we try this different diet? Did you change diet? Oh, you changed meds. Maybe we need to talk to the doctor. Maybe they've overprescribed there. We need to dial back a little bit and titrate the dosage. Maybe there's something we need to do there." So it gives us, again, the actual human some information to have a better, more informed dialogue, whether that be on the wellness or the chronic condition side. And the chronic condition can span, as I mentioned earlier, from a single condition like diabetes. Often there's diabetes vendors out there that are very specific. Diabetes almost never comes as just a one-off condition. And often it's integrated or it includes many other chronic conditions. And so we offer an integrative that will actually manage all of your conditions, which are generally quite unique to you. So it might be hypertension and diabetes for one, obesity and hypertension for another, kidney disease and obesity for somebody else. Well, we'll develop specific programs for each of those individuals.
Okay, great. Well, one of the things that we really like at Advanced Benefit Consulting is basically your case managers. And with a nurse case manager, they can actually help us to understand what's really going on with a large claim, which is really important in a self-funded health plan, right? Because, sometimes we're trying to negotiate renewal rates, right? And we need to know, the underwriters need to know, otherwise they're just going to look at the the records. They're just going to look at the claims. They're not going to actually see the full picture, right? So I know that my business partner quite often at renewal time will talk to your nurse case managers to get more in-depth reports and get additional information. The nurses can do it themselves. They can work with other doctors for peer reviews. They can do all kinds of things to kind of get into this and tell us, no, in reality, this isn't probably going to be a $500,000 claim because this is happening and they're going to move to home health care and they've already scheduled this or whatever the situation is, right? So I just want to, first of all, pass on our appreciation for that because it's something that we've been able to take advantage of on a number of occasions. And again, my business partner, Anthony, loves that part of what Hines does. So I'm assuming that we're not the only brokers and consultants that, ask you for that kind of detail. Why don't you, tell us more about that and how that works?
Absolutely. First, thank you for the recognizing that, and I'll pass that on to the team. They do a phenomenal job. They'll appreciate the feedback. It's interesting. Part of I'll call it our base offering. It's just included is shock loss notification. If someone's going to be over a stop loss threshold, we're going to include that, and with that comes a report that says,
right,
here's what's going on with that patient. Here's all the details that you might need to then have a dialogue with your stop loss carrier and go the extra mile as you described it to say, oh, you know what? Actually, this is going to come lower, and maybe we don't need to worry too much about this one at renewal time, and maybe there's no laser that's required on that specific patient, which oftentimes we're helping people figure that out and eliminate that laser. The other thing that we'll do, and this just to the stop loss side of the house, stop loss carriers will come to us directly and ask the same thing. We call that our stop loss reporting. And so they'll say, hey, we've got this book of business and we have these 3 that we're considering doing a laser. Can you tell me about that? So definitely the brokers, oftentimes the TPA, but sometimes the stop loss carriers themselves come right to us and say, we'd like to know, where is this one headed? What does the prognosis look like? How much is it going to cost us down the road? Because we want to maintain this business, but right now it's coming in hot. The renewal is going to be high. Can you do something? And our nurses will go through that in huge amount of detail and break it out for them and very often eliminate some of that cost and bring the quote back down so they can retain the business. So right. we love doing that, and that's definitely a service that's widely demanded.
We love that you love doing that. Let's put it that way. It makes our jobs a lot easier. So one of the things that Opus One does is that it puts an emphasis on patients and their families, as we kind of mentioned before. But I want to kind of expand on this a little bit. It's similar to your case management services in general, and obviously what we talked about with the concierge services. Can you tell us more about how they put that emphasis on the patients and their families?
So what I'd like to do here, if you don't mind, is just give you an example, a story of a young lady that we were able to help. So a family had moved from New York City to Chicago area. It was a single mother and her actually twin daughters, 9 years old, and they were struggling with hypogammaglobulinemia. It's a difficult word for me to pronounce. I'm not a clinician, but essentially it means she had a weakened immune system, and so she was susceptible to a lot of different things. And there was a treatment that she was receiving in New York before she moved, IV therapy at a clinic there, and the doctor there had said you have to come back, for this treatment once a month. And so she was going back to New York once a month, jumping on a plane, staying at a hotel. There was an out-of-pocket cost that was involved there for the family, which was fantastic, except that this doctor had said we're the only clinic in North America where you can get this. Right. Well, our nurse found out that this was going on, got involved, and she said, hey, Mom, let me talk to you about what the options might be, because I think Chicago's a pretty big city. There's probably some options here. She did some research and she found, absolutely, there's options locally. In fact, there's an option locally where we could have somebody come to your house and administer the IV therapy. Well, the mother was, thrilled, and of course the young lady was as well. Well, I don't have to jump on a plane and fly to New York, once a month for 2 days every month.
And
that's fantastic.
Home health care is a lot less expensive for the plan sponsor too, so I'm sure the employer was pretty happy with that as well.
Well, exactly. So $26,000 less expensive to stay at home and have it there instead of over there. But then on top of that, as you mentioned, I'm not paying out of pocket for these flights and hotels. So Mom now is saving probably $600-700 a month easily in flights and hotels and everything else. overall, it was $500,000 that we saved for the plan annually, and about $8,000 in out-of-pocket expenses for the family. And even better yet, this young girl is now getting care in her own home. She doesn't have to go anywhere, and she can focus on living what a young girl's life should be instead of on jumping on planes. So that's the type of thing where we get to work with the families, build those relationships that I talked about, because you got to build that trust, right?
Yeah.
Mom, of course, initially she's like, oh, it's the insurance company calling. That's all they care about is the money. Well, no, it's not all we care about. Let me explain. We're looking at options, and our nurse was able to explain where we were coming from and build that trust. And then the mother was thrilled at the end of the day. And of course, the young lady was as well.
Right. And of course, you're not an insurance company. So
well, exactly. But, you're always the representative of the insurance, right?
Exactly. Yeah. Well, let's talk more about Opus One care navigation. Obviously, you can help steer patients, as we talked about in the beginning, patients and plan participants to lower cost providers, which you've already talked about. And basically that can help, as you gave a couple examples, with treatment plans that are designed to save, money for everyone, the families, and you gave some great examples, as well as the plan sponsors. So can you just talk a little bit more about the care navigation?
Yeah, actually, what I'd like to do is, again, just give you a story, an example of where that played out. Yeah. One of the things about RBP in general that I think not everybody fully appreciates is that, yes, if you're going to peg it to some percentage of Medicare, so let's say 150 Medicare, you've kind of controlled the cost.
Yeah.
But if you can change the setting of care, Medicare at a hospital and Medicare in a clinic are two wildly different amounts. Yeah. So even within RBP, there's an ability to really manage things. So the story I was going to relate is Bob, actually, he's one of our employees. He needed to have a spinal injection, and he went to his normal family physician, and the doctor said, hey, the clinic at the local hospital, that's where you should go for your spinal injection. And of course, that required a pre-cert. So the plan got involved and said, okay, pre-certification, where are we going to send you for this? Or pre-certification, first question, is it medically necessary? Yes, this is the right treatment for your situation, the back pain. He had been having back pain for several weeks, poor guy. And so, yes, that's medically necessary. What's the best option for you? The concierge gets involved and says, hey, here's 3 different options, including one that we reached out to a local physician's office and negotiated with them, showed him the quality on it. So the billed charges was going to be $11,000, $12,000 at the hospital. It was going to be about 7 or 8, I believe it was, at the physician's clinic. But the Medicare amount, if you just say 150 Medicare, you're talking about the difference between $1,800 and $1,100. So the payment amount was going to be way less. Now, of course, out of pocket to Bob was going to be less because he's not going to have to pay as much. Plus, if you go to the hospital, that's out of network. That's RBP wise. You're not getting any additional support if they decide they're not going to accept the Medicare amount. So you could potentially be on the hook up to the $11,000. The plan saved about $800 by getting him into an outpatient clinic. It was more convenient, easier for him to do it. Actually happened to be closer to his house as well, which was just a nice bonus. And he saved about $400 out of pocket expense. So that's a win-win all around. That's what we can offer when we look at care navigation. It is not just, hey, who will accept the deal, but by moving it to a different site of care, you can save even more.
Right. Yeah. Again, the plan sponsors are going to love that. The underwriters are going to love that as well.
So, yeah, we actually did, just so everyone's aware, Bob is an employee of ours, but has given express permission for us to share his story. He's actually very proud of it. It's one of the things that he frequently will present this. He's part of our marketing team and will actually present his own story. So we're very happy to have that as a case that we can use.
It's nice, especially coming from an employee. That's nice of him to allow you to do that. And I'm happy that he's doing so well. So I want to ask you a final question. What does a self-funded health plan sponsor need to know, if you had to summarize it in just a few sentences, about why Hines is better positioned than a lot of other cost containment vendors?
I think I can do that actually in 2 words. One roof. The end of the story is we can do all of it under one roof. You don't have that risk of things falling in between the cracks, which no matter how good everyone is working together, it's going to happen. It's bound to happen. And so when you've got it under one roof, if we drop the ball, you know who to go to, and we're going to fix it. I can guarantee you.
Yeah, well, I appreciate that very much. And unfortunately, we're out of time. I'd love to continue this discussion for another hour, but unfortunately, sometimes our audience needs to get going and so forth. So I will cut this short. But thanks so much for being with me today and sharing all of this new and innovative cost containment program with our audience. We really appreciate it.
No, a huge thank you to you and your audience, and hopefully we gave you some food for thought and things to think about as we're trying to all tackle this challenge together.
Well, thank you again very much. If anybody should want to reach out to you, how would they do that?
So you can reach me email. It's SMCCLUNG, S McClung, at Hines Associates, HINESASSOC.com. Look me up on LinkedIn. You can find me there. Or if you want to go on our website, it's HinesAssociates.com, HINESASSOC.com.
Great. Thank you very, very much. And I just want to say once again, thank you to Hines for all the services that you provide. And, again, Steve, thanks for sharing all this wonderful information with us. I really appreciate your being here today. To everybody else out there, please stay safe, stay healthy, and stay tuned for the next episode of the Benefits Executive Roundtable. Thanks, everyone.
Thanks for watching. Stay tuned for compliance tips, cost containment ideas, new trends, and decision-making tools. This podcast is produced by Advanced Benefit Consulting, Fullerton, California. All views expressed are those of the host or interviewees and not necessarily those of Advanced Benefit Consulting. Information contained herein should not be construed as legal advice. We always recommend that you consult with your legal counsel as situations do vary. Ms. Cociu can be reached at 714-693-9754 extension 102. or toll free at 866-658-3835. By email at dmcociu@advancedbenefitconsulting.com or visit our website at advancedbenefitconsulting.com.